Looking good. All right, good morning, everyone. I'm Amanda Tokiyama um, from the Urban Ecology Center, joining you today to talk about our study that we've been working on for the past 18 or so months, Relax and Breathe Easy. But we'll start with just saying thank you. As always, Backyard Naturalist would not be possible without viewers like you. And for all the new faces joining us today, you too can become a Backyard Naturalist subscriber. And your subscription includes weekly lectures, a monthly field trip, and a subscriber appreciation party. And we have seasonal and annual subscriptions available on our website. Also want to quickly plug our Christmas bird count. We'll be joining with Schlitz Autobahn to do our annual Christmas bird count this Saturday, tomorrow. We'll be running two different routes, one on the east side, meeting at Riverside Park and going up to Capitol, and one on the west side, meeting Tim behind the domes in the Menominee Valley and making their way over to Washington Park. Okay. So as Tim mentioned, we all know and feel how important outdoor spaces are to us, especially living in a city. And that's kind of how Backyard Naturalists came to be, in this desire and need to be outside. And what we know is that there are a lot of benefits that come from green spaces, from just providing economic benefits to our cities, spaces for urban wildlife, but also really important benefits to our physical and mental health. And that was something that this study focused on. So we wanted to understand the role that different green spaces play in affecting our health, particularly our stress, and then examines very specific characteristics of these green spaces to determine how differences in things like air quality, health measures like stress, vitality, attention, alertness, etc., are influenced by being in these green spaces. And so this is a partnership between us at the Urban Ecology Center, the Medical College of Wisconsin, 16th Street Community Health Centers, and Wiscorps in La Crosse, funded by a grant from Advancing Healthcare Wisconsin. And so our study took place in the state of Wisconsin in two different cities, Milwaukee and La Crosse. Milwaukee being the largest city in the state, and La Crosse having a smaller population, but being a important partner to the Urban Ecology Center at this moment. Within Milwaukee, we use 6 different parks, 3 on the north side, 3 on the south side, including Kosciuszko Park, Three Bridges Park for our Menominee Valley location, Riverside Park, Washington Park, Pulaski Park, and the KK River Trail. All were fully paved and accessible, and we've had English and Spanish speaking participants, as well as facilitators. On the La Crosse side of things, they surveyed at the Myrick Park Center, now the home to the Nature Place, and then their adjacent La Crosse Marsh. And so our participants, we had 73 total participants, ranging in age, mostly female, but we completed a total of 149 park walks. We asked participants ideally to come and walk with us twice. Some people came 6 or more times, but most people came at least once to complete one of these 149 walks. And how this study worked was, when our participants would come, we would give them a little bit of pre-walk background. We would do some surveys about their demographics, their park use, their self-reported stress. They take a little test that I'll talk about in a little bit. And then they would go out and take a walk, and we'd hook them up with some devices also that I'll talk about in a little bit. And then when they came back, we would repeat some of these self-reported stress surveys and like the digit span test. And so what some of those self-reported stress surveys look like are these. So we have our vitality scale, measuring like how vital you feel, how energetic you are, our restoration scale, measuring stress, restoration, calmness, and then this affect grid, which measures how energetic someone is feeling on our y-axis and how pleasant or unpleasant they're feeling on our x-axis, with these example words in the corners to say pretty much exactly how you feel if you're in one of the four corners. So they would fill those surveys out, and then they would take this little test called the digit span test. If you're unfamiliar with this test, how it works is a facilitator will say a series of numbers, and you're supposed to repeat those numbers. So for example, you start with a couple digits going forward, so repeating it in the same order. Like for this one, 7, 4, 9, and you do it as many times as possible until you essentially mess up. So you can go up to 9 digits, and then we'll repeat the test, but saying the numbers in the reverse order. So I would read 7, 4, 9, and the idea is that the person taking the test would say back to me 9, 4, 7. So if you didn't participate in the study, you might see how this might be a little bit stressful. But they would take this test and go out, and we'd hook them up with a couple different devices. So one being our air beam, which measures air quality in the form of particulate matter. For anyone unfamiliar, particulate matter is essentially any materials that are in the air that can range in size from what's called PM10 down to PM1. So PM10 is about this size, about the size of a dust particle or a grain of pollen, down to PM 2.5, different type of dust particle, things like soot, etc. And then getting even smaller, things like wildfire smoke and viruses and bacteria. We'd also hook them up with this device called Kestrel. It is a weather monitor. It measures things like temperature, humidity, wind speed. That's pretty much that. And they carry that around. And then everyone would get a personal device called an Emotibit. I've always described these as like a fancier form of like a Fitbit or your Apple Watch. It is measuring a bunch of different things, one of which being just like heart rate variability, your oxygen, a different measure called EDA that we'll talk about in a little bit. But it's measuring a bunch of different things individually as you walk. And then we'd have them go and take this walk at one of our 8 parks on a predetermined route. So everyone's walk was pretty much the same. And what we found, at least anecdotally, is a lot of people came back saying they felt more relaxed, they felt more energized, it made them happy. Someone wanted to be a beaver, but different things about the walk making them feel more relaxed and energized and peaceful. And that holds true in terms of our self-reported scales of our different stress measures. So one being vitality, our subjective vitality scale has scores ranging from 7 to 49, higher scores indicating a better condition, being more vital. And so a greater mean difference between pre-walk and post-walk is signifying an improvement in condition. And what we found is that there was a significant difference, higher vitality between our pre and post-walk scores. And the same holds true for our affect grid. This, again, is designed to measure two different dimensions of our affect, pleasure and displeasure, or pleasant and unpleasant feelings, and arousal and sleepiness. And so the arousal scores range from 1 to 9, 9 being the most energetic or aroused, and pleasure also 1 to 9, 9 being more pleasant feelings, and a greater mean difference between our pre and post walk would signify an improvement in either arousal or pleasure. And with arousal, there was a smaller difference, but we did find significant differences in our participants between our pre and our post walk arousal scores, and a larger difference, also significant, between our pre and post walk pleasure scores. And then we have our restoration. So we also found increase in restoration. People feel more calm, they feel more constant, they feel they can concentrate better and feel more alert. And again, we found significant differences between our pre and post walk in terms of our self-reported. In terms of the digit span, which is our more objective test of attention and alertness, we found people in a non-significant way did worse in the forward testing. So reading the numbers exactly as we say them between our pre and post walk. But in terms of the backward, so what a lot of people anecdotally said was the more stressful part of the test, us reading the numbers to them and then repeating them backwards to us. Most people did better after their walk. And so now, what are we doing with all this? Soon there will be an interactive web map that displays some of these measures that we studied for each park. That will be available on the Urban Ecology Center's website. And so some of the things that we can look at are aggregate walk data, as well as individual walk data. We measured some things like biodiversity, temperature, humidity, air quality, heart rate, and EDA. And so on this web map, the idea is that we can go through and look at all these different measures for each park. And then for us, our next steps would be to link that data to better understand this question that we had of what specific characteristics of green spaces are associated with these differences. So we did find these differences, but we want to know what's contributing to these differences. Is it things like biodiversity, air quality, tree canopy? We want to use our geospatial data to better answer this question. And so this was designed to be a little bit of a shorter presentation, so because we have some great members of our team here to answer some questions about the study. And I'll introduce them, but thanks for everyone who participated and everyone on our team that helped facilitate this, as well as our funder, Advancing a Healthier Wisconsin Endowment. And we have lots of time for some questions. So I'll stop sharing.